Welcome, everyone. This is one of a series of talks that Gift of Life does on approximately a quarterly basis about the world of transplant and what's going on and some of the key topics that we hear from our community. Today's topic is mental health for transplant patients and their caregivers. You all may want to change the view on your screen, and you should be able to do that by clicking on the view. It may appear at the top of your screen right now because I'm sharing my screen, but you may want to focus just on the speaker once my slides go away so that you're not distracted by all of your cohort in the audience, but whatever works best for you is fine. And a little bit about Gift of Life. Gift of Life is a nonprofit organization. I am the executive director, Julie Klima, and we as an organization promote the support, awareness, and success of organ, eye, and tissue donation through education, mentoring, and collaboration with partners and individuals in the transplant community. Transplant Mentors is one of the two signature programs that we offer. The other is a classroom education program for high school students. The Transplant Mentors program is offered nationwide and pairs trained mentors with transplant recipients and their caregivers, as well as living donors, to provide information and support through the transplant process. You can find out more on our website at giftdonor.org. Joining us today are Johnessia Jackson, who is a medical social worker with as a transplant social worker at St. Luke's Health System. She also has a private practice that provides therapeutic services to individuals with chronic disease and their caregivers. You can find out more about her practice at convergencecounselingkc.com. And we're also joined by Reverend Kathy Riegelman, who is a Unitarian Universalist minister and a board certified chaplain who's serving as the chaplain for the University of Kansas Health System's transplant programs. So we've taken questions in advance for today. So with that, we're just gonna talk a little bit for a few minutes. So let's start with a relatively easy question, but as we seek to normalize, the mental and spiritual health and support, what would you say are some of the normal, quote unquote, normal feelings that you've seen patients experience when facing a transplant? Do you want to start with that one, Johnessia?
Sure. Hi, everybody, first of all. So I think transplant patients experience a continuum of emotions, right? You can experience anger. Sometimes when you're initially diagnosed and told that you have heart issues or kidney issues or liver issues, there's like a denial phase, almost like, no way, I can't be having these issues. I ate properly, I worked out, I did all of these things, and how did I end up in this situation? And just today I had a patient express some anger. It was anger and confusion because for him, nobody else in his family has these issues, and here he is needing a kidney transplant. So there can be lots of questions. Why me? How did I become the chosen one to have to experience this and need a transplant? And so I hope what you get from understanding those continuum of emotions is that it's normal and that you are not the only person experiencing those emotions. There are other people in similar shoes who have the same emotions surrounding chronic disease and transplant.
Yeah, thanks, Johnessia. That's a really important observation, that anger can be so much a part of this process. And also, along with that, I'm going to touch on a couple of the hard emotions. I hear people express a lot of fear. They have fear that they may not make it through the surgery. That's not unusual for me to hear, which again is incredibly normal for someone who's facing a big surgery, or maybe fear of rejection of the organ, which it's always good to get those fears out front and talk about them before going into that surgery. I also hear people express feelings of guilt and or shame. And those can come with some of the particular solid organ transplants that may have been contributed to by maybe not such a healthy lifestyle, which is really hard for folks to deal with at that point. I really like the difference that Brene Brown makes between guilt and shame. Guilt being that I am a bad person versus shame, I did something bad. Some people that affects their sense of worthiness. And so again, I've had a lot of conversations as a chaplain with people that are struggling with how they kind of got there. And again, just talking through it and helping them look forward instead of back can be really helpful. Thank goodness there are some really positive emotions that come with transplant. Of course, there's hope and there is gratitude, just that deep gratitude that someone is willing to make the gift and that they have this opportunity to move forward with their life, looking for better health and more time with all that makes life meaningful.
Mm-hmm.
That's really helpful. Thank you both for that. This is kind of along those same lines, but what do you have in terms of suggestions for patients that are waiting, particularly when they're waiting for a deceased donor organ? How do you suggest they deal with both the waiting and the fact that someone is going to have to pass away in order for them to continue to live? Kathy, do you want to start on that one?
Sure. And I think this is, one of the most difficult issues that recipients and potential recipients deal with. So I'm going to dive into the hard part of it first, which is, that recognition that this is someone, there's someone out there that isn't going to make it, that's going to die, and that's what makes this possible. So what I really encourage people to do is to separate their experience, their event, from another event that they have absolutely no control over. These are absolutely independent events, that there's no cause and effect with the recipient and with the donor. There's no overlap on that. The only way that these two amazing people's lives will come together is because someone's generous enough to make the gift and someone's ready to receive. So they're two independent events that do have a crossover, but without any cause and effect. I also help people remember that this is a gift. A donation is a gift. It doesn't come with strings attached. It's something that someone is giving to someone that they don't know who it would be, probably never expecting that they would make that gift. I mean, I know that we have live donors out there, so that's a little different story. I see a familiar face out there when I saw John signed on. So that's a little bit different situation. But when someone is waiting for a deceased donor, there can be a lot of feelings of how do I wait? How do I pray for my own situation, knowing that someone's life is going to be lost because of that. I just learned today a beautiful turn of phrase. When I think of the generosity of spirit that comes with donation, someone referred to the kind of that dynamic of donation and transplantation as tragically beautiful. And that really kind of stuck with me, that there is tragedy, but there's something so beautiful and so hopeful that comes out of that. I often, as a chaplain, if prayer is a part of someone's spiritual practice, I encourage them to start praying for a family and a donor out there that they don't know who they are. I think sending those intentions out can be very helpful in knowing that there is that recognition that there's going to be an as we sometimes refer to it, someone's worst day is another person's best day. So sending those prayers out and letting that part of a person's spirit extend beyond themselves is very helpful. So I guess the only thing else I want to add, and then I'll turn it over to Johnessia, is I think that the best thing a person can do while they're waiting for a deceased donor is to know that they're going to bring hope to that family by living a good life and being a good steward of that organ. And by doing that, they are honoring that person's life in the best way possible.
Yeah, I totally agree. And I was gonna say that the best way to be grateful is to be a good steward. Take care of the transplant, take care of the gift that you've been given. And I would add to that as well, writing your donor family is another way to kind of help separate the fact that someone had to die in order for you to have this gift of transplant. Write your donor family, let them know, hey, thank you. I'm so sorry that you've had this experience, and thank you for allowing your loved one to donate, be a donor, so that I could receive this gift. And then in terms of the waiting period, so I work primarily with kidney and liver patients. So there could be years of waiting for those patients. And so how can you fill your time so that your mind is not always thinking about the fact that you have to wait, right? What are some things that you love to do? Can you do some art? Can you journal? Can you be an advocate and or a mentor for other patients? If you're a kidney transplant patient in your dialysis center, there are opportunities to be an advocate and help other patients who are on dialysis. So finding some purpose in your wait, finding some things to fill your time that are positive.
I want to back up just a little bit on that, because yeah, that's so helpful, and that waiting period can be really difficult. I work primarily with heart patients these days, and sometimes we have people that are actually waiting in the hospital to be transplanted because they're at a high status. And I really encourage them to keep some structure in their day, not just to sit so that every day is this kind of one long endless wait, but you know, like kind of knowing that they are going to get up and have breakfast and maybe go for a walk, and then maybe do something that's a hobby or a craft or a game, or watch a movie and then have their lunch and then maybe rest for a while. I mean, there's just all kinds of ways that people can look at what they would normally do in their life and then kind of, transpose that into a hospital waiting experience, which is a little different than many of our folks out there that are waiting at home. So just another thing to think about is trying to provide some structure.
That's really, I was really struck by the tragically beautiful turn of phrase. But going back to the waiting, I'm going to skip ahead to another question that we were going to ask later. So you've talked a little bit about finding purpose and meaning, during that waiting period pre-transplant. Can you speak a little bit to how patients can find purpose and meaning post-transplant in this new world that they're living in, and also how the caregivers in their lives can help support that? And Kathy, you want to take that one first?
Sure. When I'm really privileged that when I'm working with patients that are maybe working toward a heart transplant, in that evaluation process, one of the things I really find the most helpful is to try to explore what the patient's sources of meaning and purpose are. There has to be a reason that someone would go through this. There has to be something important that in their life that they want to live for. And I'll tell you, this is a time when I really find that people's emotion surfaces is when they're talking about what makes their life worth living, literally. And I think doing that pre-transplant is so important because it can be a time of deep spiritual growth for people. I want to just say that my definition of spirituality is energy directed in the search for meaning. And so that can be connected with faith and specific religions or religious practices, but it's also bigger than that. So whatever we put our energy into that creates meaning and purpose in our lives is what we want to work toward. So I find, and just kind of to give you some examples, some of the things I hear most commonly are, of course, family. There's often a very strong focus on wanting to be around for children or grandchildren, for their loved ones. People's faith is very important. Spending time in nature can be very meaningful, can be a place of connection. And I hear a lot about people's pets. That's just those little four-leggeds bring a lot of love to our lives too. And so identifying that is really important. And I think if someone's in a place where their health isn't allowing them to engage in all the activities that make life meaningful, I try to encourage them to back up and look at what it's really about. Like, for example, if someone loves to downhill ski or to hunt, but they're not able to, well, can they still be outside? Can they still connect with nature, even though they may not be able to do those activities? If you're maybe, do something really physical like a rock and roll drummer in a band, but you can't do that, can you still enjoy music by listening and appreciation, or finding a way to modify those activities so that you can engage in them? I think there's a shifting of priorities often when people are going through something so big. This is a big deal to go through. And I encourage people to focus not on what used to be important, but what they're identifying now that really brings meaning to their life.
Johnessia?
Yeah, then I would say for caregivers, being that support person for that patient or for your loved one is to encourage it and maybe assist in planning those activities. So if they love to dance and maybe physically they can't dance, can you sit together and watch Dancing with the Stars? Maybe there's some sort of joy with that patient being able to watch other people dance. If it's art, if it's music, encouraging that and making plans, being creative and trying to make sure that they can enjoy those things that they love to enjoy, even if it has to be modified.
Mm-hmm.
That sounds like a lot in line with this another question we had that was about compliance, or maybe good stewardship is a better way to talk about it. What do you suggest for people that are trying to adjust to that new chronic disease diagnosis and the associated lifestyle changes that their medical team is recommending? Sounds like you've got some great suggestions so far, but anything else you'd add specifically on that compliance side?
So I would say in terms of adjustment to a new diagnosis, if we really break that down to think about what's at the heart of it being difficult to adjust, and that's the anxiety of it. That's the unknown of a new disease, all of these medications I have to take, all of these doctor's appointments I have to do. And so what I often suggest in dealing with anxiety is making a plan. So, when we're talking about all these new medications that you have to take, can you use a pill box and fill that pill box weekly? So whenever the time comes for you to take your medications, they're already organized. You just have to flip open a cap and take those meds, versus leaving them in a pill bottle and then you're anxious trying to figure out, how do I take all these different meds? And because there's no plan or no organization to the medications. And I would also say trying to be as mindful as possible, very forward thinking or future thinking because of the unknown. And so how can you be mindful? How can you be in the moment? Okay, here's what's happening right now. I have to get ready for a doctor's appointment. I'm not going to worry about what they're going to tell me or what's going to happen at the appointment. Let me just get ready, prepare myself before this appointment, so that we limit the future and forward thinking that gets our mind to spiral, and we just stay present to be able to focus on what it is that we need to be doing in that moment, if that makes sense.
You know, I
Kathy?
hear a lot of people say, you know, I'm just taking it a day at a time. And that's exactly what that is, that kind of mindfulness. And sometimes a day is too big. Sometimes you have to break it down into a morning or an afternoon or a couple of hours. I also encourage people to think about what's helped them cope in the past. And to draw on, you know, again, kind of doing some really good reflection on how you've gotten through difficult or adverse times in the past and apply those same coping methods, and then maybe trying some new things. You know, I encourage people to journal what works, what doesn't. And one of the things that I think can bring some meaning and purpose to being compliant is to think about maybe the healthy changes that a patient is making in their life is modeling for their family and those around them, you know, a healthy lifestyle. It's because we talk with people all the time that have to stop smoking or modify their diet, and that is a huge one. And so the healthier they are living, the more it helps those around them see that that's a good thing, you know, or working exercise into their lifestyle. So they're not only helping themselves, they're helping their family. And I think, again, that can bring some meaning and purpose to being compliant, because it's tough. There's a lot that's asked of folks that go through transplant.
And is it okay if I add also, it's important to try to have a switch or transition in our self-talk in the way that we think about things. So, oh crap, I got to stop smoking versus, okay, I have to stop smoking and this is going to be a healthier lifestyle for me so I can be a good transplant candidate. Or, oh crap, it may not be healthy for me to eat McDonald's or drink over a liter of water anymore because I have to watch my fluid intake. Versus, oh, okay, here's my new normal. I can only drink a liter of water, and that's going to maybe lessen the amount of volume that has to be taken off at dialysis. So having a switch to a more positive self-talk about the changes that have to be made.
That's really helpful.
And then just one more thought is I try to encourage people to know that they're human. And, you know, that means we're not going to be perfect. And one day, if there's a little slip, it doesn't mean that the next day there's going to be more. You have to give yourself some grace and forgiveness too.
Mm-hmm.
That is so critical to recognize. So I want to take a step back real quick and talk about anxiety. You brought that up, Johnessia, and its friend, depression. We had a couple of questions related to this, and just helping people recognize, I think, when they might need to seek additional help. Do you have recommendations for how early post-diagnosis mental health should be evaluated, and how often post-transplant? Particularly, another question was about depression being common post-transplant, either from the transplant or the medications. Can you speak to that a little bit about how to recognize that, when to seek help, when to be evaluated, that sort of thing?
Sure. So I think, you know, the most important part is going to be making sure you have a good understanding of what depression looks like in general. Now, depression can manifest in different ways for different people, but in general, here are some things you want to look for. Isolation. You don't want to be around anybody. Maybe you want to stay in bed, covers over your head and not be bothered. You don't want to leave the house or go to your doctor's appointments. Sometimes it comes out as anger, irritability, lack of sleep. And then when we think about anxiety, again, it's that continuing to forward think. Your mind is racing. You can't concentrate. Maybe you have heart palpitations, panic attacks. Sometimes it manifests as sweaty palms or sweaty armpits. So just first step would be recognizing what those signs and symptoms are of depression and anxiety. And secondly, I would say that when you have, and this is based in research, when you have a chronic disease, you are at higher risk of having depression and anxiety. When you think about all the things that we've discussed so far, change in routine, you have this new diagnosis and how you cope with that. And so all that plays into having a chronic disease and the increased risk of having depression or anxiety. So there are a couple of self-assessment tools that you can Google and it'll pull up that you can take yourself. Now, this is not to diagnose yourself, but just to see if you have symptoms of depression or anxiety. And that's the PHQ-9 and the GAD-7. The PHQ-9 assesses for symptoms of depression and the GAD-7 assesses for symptoms of anxiety. So those are really quick tools that you can pull up on the internet and kind of see if you are experiencing any of those symptoms. Then I would say in terms of depression or anxiety post-transplant, it is so very, very common. When you think about all the changes and doctor's appointments and so on, that gives you lots of anxiety, all the new things that you're learning. You may not necessarily be able to be around all of your family members since you are now immunosuppressed and your body's adjusting to these new medications that you're on, infection risk. So you may have to, be a little isolated in the beginning phases of post-transplant. Or maybe your family didn't show up for you like they said they would. All of a sudden, they can't bring you to doctor's appointments. Who wouldn't feel sad or down about lack of family support? Maybe the transplant process hasn't been easy. You had struggles afterwards, infections or having complications post-transplant. Absolutely, that will cause you to have some depression or anxiety. And so it's important to, in those phases or in those moments, as you're recognizing you have those symptoms, forming connections with people is helpful. Talking with your wife or husband or kids, whoever your support system is, to say, hey, I'm feeling this way. I'm a little bit sad about how things are going. Having access to your transplant team. If you are feeling depressed, talk to your physicians about it. Talk to the social worker about it, the chaplain about it. Because maybe, when you talk with a physician, maybe there's a reason medically or from the medication side effects as to why you are having depression or anxiety. And so having good communication, recognizing your signs and symptoms, and reaching out for help when you do have some signs and symptoms. So I would say to the first part of the question that you want to check your mental health early and often. There's no length of time or right or wrong answer, but just be really diligent about being attuned to yourself, and caregivers being really diligent about checking in with the patient to see how they're doing or recognizing the signs and symptoms of depression and anxiety that they may see in their in the patient that they're caring for. Sorry, that was a lot.
That was wonderful. Thank you. Kathy, do you have anything to add?
Well, I just want to reiterate the importance of staying on top of one's mental health, because we know that depression is really, really bad for the body too. And so how one heals physically, it just kind of reinforces my believing that, we are more than our bodies. We're emotional beings, we're spiritual beings, our mental capacities, all of that contributes to who we are as a human being. And unfortunately, when one is struggling with anxiety or depression, it can hold you back in your physical healing because it does have such direct physical effect on your body. I also want to say that, I'm obviously interested in people's spiritual well-being. And some people do experience some spiritual distress, which is not the same thing as anxiety or depression. But spiritual distress is when someone's beliefs or values kind of get called into question. I've had people that have struggled because it's like, well, if they believe in a God who's all powerful, then why hasn't God just healed me? Why do I need this transplant? Or maybe they have their religious system or their own personal beliefs have not been congruent with donation and transplantation, and here they are needing a transplant. So that kind of, can cause some dissonance in a person on a spiritual level, which is why it's so important to have, a variety of people that can address those concerns. And hopefully, there's a chaplain on the team, or people have a pastor that they can connect with if they do have some spiritual distress. And it's also important, I think, just to be able to kind of tease these all apart, because they can become kind of just one big hard thing to deal with. And really, there are different components to mental and spiritual health that can be addressed in ways that can help patients and just move forward in such beautiful ways.
Very true. To the both sides of the coin have to be addressed, both mental and spiritual. So thank you for calling that out. We've talked a lot about the patients, but we know that the patients aren't the only people affected here. Can we talk about caregivers for a moment? A couple of the questions that came in were around balance between, the caregiver as an individual that's still taking care of their family, still working, still has a professional life, but is also called to care for this transplant recipient or this transplant patient. Can you talk a little bit about that, about what you would suggest for those caregivers in finding that balance, and particularly, are there any resources that you would suggest?
Sure. The number one thing I always like to suggest or point out is to make sure that caregivers maintain their own identity, own activities, own thoughts, and your own ideas. Because sometimes what happens, specifically when we are caring for people who are very, very sick and they may be total care, we become very enmeshed in caring for that person, and that becomes our identity. We lose ourselves in being a caregiver. So figuring out ways to maintain your identity. If that's sitting down, thinking about the things that you love to do or would love to do if you had the time, and finding creative ways to be able to do those things. So I know winter's coming up. If you were an ice skater and you love to go ice skating and chill, and that was your thing, maybe plan an outing for yourself. See if there is a family member or a friend that can sit at home with your loved one. There are also resources where you could private pay for a caregiver, like a home health aide through an agency, to come and provide respite services so that you can get some time to yourself. If your loved one, the person that you're caring for, has Medicaid, either Missouri or Kansas, there are resources for that. Medicaid pays for respite services. Medicaid pays for aid services. They may not necessarily pay for someone to be a sitter per se, just to be there while you go and run errands, but there's help surrounding light housekeeping or making sure the patient is bathed and groomed for the day. So, taking advantage of those resources through Medicaid to be able to help you. And, going back to the things that you like to do, just being creative and finding ways to do the things that you love and have time to yourself. And I understand that that's easier said than done, but you have to be creative and figure out how you can still be you, still do the things that you love and not lose yourself in being a caregiver.
Kathy?
I think, wow, Johnessia really, really spoken that well. I think the only thing I would add to that is that knowing that you can't do this alone. One person being a support system is asking an awful lot of anyone. And so I think we really encourage our patients to kind of cast the net wide. One person may be able to provide transportation. One person may be that one that can come over a couple afternoons a week and just sit with someone. There are people that have amazing support systems, and there are some who kind of have to do some work. It's hard for people to ask for help. And so I tell them that they can start trying to work on that as a spiritual practice. There are different ways that we can ask for help, and knowing that other people feel good when they can help also, so it's not about being a hero. It's about trying to, again, cast that net wide and get folks involved that will be able to help fill some of those gaps. I kind of encourage people to identify kind of a few kind of rescue self-help things that don't take a lot of time. That could be just having a safe place to let your emotions out. It could be taking a walk, a quick walk. It could be, a little of what I call primal scream therapy, just being able to step away and just kind of let it rip for a minute and then take some deep breaths, being able to meditate, just having a little time alone. Caregivers are so involved, of course, in that work of another person's well-being that it's so easy to overlook our own. And set some healthy boundaries. That's good for everyone. There's only so much that a person can do.
Mm-hmm. Yeah. And, if I could add some additional things, if you think about when you're on the airplane and they're giving you instructions on what you need to do in case of an emergency, what do they tell you? Put your mask on first. And then if you have anybody else with you, a child or an older adult, then you put your mask on. So all that to say is you have to take care of yourself first. Make sure you're eating right, sleeping, going to your own doctor's appointments, taking care of your own health so that you can be a good caregiver to, or be available or be healthy enough to take care of your loved one. I would also add to, again, be creative, think of things that need to be done, but how can you do them in a easier way, or it takes less time? Grocery shopping, can you order them ahead of time and go pick them up, or can you order them and have them delivered? Like finding creative ways to get the things done that you absolutely have to get done, but how can you maybe make it easier or reduce the time that it takes? And last thing I'm going to say is making connections with other caregivers. That is so important, so that you know and understand that you're not the only one experiencing the tiredness, sometimes the lack of motivation to want to be a caregiver, the frustration that can come with being a caregiver, and understanding that there are other people in the same boat and how can you make connections with those people, because that gives you a sigh of relief when you understand that, okay, I'm not the only person experiencing these things. So I do have a caregiver support group starting November 18th. It's virtual. I think at the end of the presentation, my email is there. So if you're interested in being a part of the caregiver support group, then you can definitely email me to register. But I think connection is very, very important for caregivers.
And before we shift over into some of those rescue exercises that Kathy mentioned, I also want to mention that the Transplant Mentors program is here not just for patients, but for the caregivers that have been through the same thing that you're experiencing. I mean, every transplant is different, but you can connect with another caregiver that way as well. So with that, I want to go through a few actual exercises, self-care exercises. So I want to invite you, if you have your camera on and want to turn it off at this point so that you can really focus on the speakers and what they're saying and the exercises that they're leading us through. You don't have to, but if you feel self-conscious, sometimes you want to turn off your camera. And we're going to start with Johnessia, who's going to lead us through a breathing and tapping exercise.
Yeah, so this is something that I do with my therapy clients, is deep breathing. Deep breathing is always a way to get you back to center and get you back grounded. So deep breathing coupled with tapping. And so tapping is just another way to provide a sense of calmness, and it is, for some people, they find it to be soothing. So what I'm going to invite you to do is, if you're in a comfortable space and you're comfortable with closing your eyes, I'm going to invite you to do that. So close your eyes if you feel comfortable. Otherwise, leaving them open is fine. And I just want you to begin taking some deep, natural breaths in through your nose and out through your mouth, just naturally breathing. And just focus there, just in through your nose, out through your mouth. So now I'm going to introduce the tapping. So what you can do is you can do a butterfly tap, and that's just putting your arms here and tapping very slowly. Or you can put them on a desk, or if you're on a table, you can tap slowly there. Or even on your legs, you can tap slowly there. I personally like the butterfly tapping, so that's what I'm going to do. And so as your eyes are closed and you're taking natural breaths in through your nose and out through your mouth, you can start tapping. And that is just, again, a good way to come back to center, to relax and calm yourself. So that's something you can try at any point. You can be in your office having a bad day and you need to close the door and do some breathing and some tapping to come back to center and to ground yourself. So hopefully that's a tool you can use in your everyday life.
Thank you for giving us that practical tool that we can use today. It's a very comforting thing, even just focusing on your breath. I want to now turn it over to Kathy, who's going to lead us through a centering prayer.
I think there's a couple things I want to offer you today. The first is that we could come up with a very simple centering prayer, and that can be either, a portion of a prayer that you already know, maybe something very short, or you can develop your own. I worked with a patient who was experiencing a lot of physical pain as he was waiting to get on the transplant list and hoping that he could. So he was having a lot of physical pain, and then there was a lot of fear, especially about whether he was going to be able to be listed. His health kept sliding. Eventually things did come together for him, I'm happy to report. When we identified what he was struggling with the most, it was pain and fear. And this was a person who was a Christian and had a deep belief. And so what we tried to do is take those emotions and take them out of him. So the prayer became, God, take my pain. God, take my fear. Repeated it over and over. God, take my pain. God, take my fear. So that he wasn't holding it, but was giving it over to something larger than himself. And that seemed to help him, and it was easy to remember. So again, it was kind of boiling down to, what is it that I'm really struggling with? So that can be, I think, really helpful. And it might be good to work with someone to help you identify those struggles if you're having trouble kind of narrowing it down, and finding a way to make it both a prayer of centering and a prayer of release, if that would be helpful. Another practice that's actually an ancient spiritual practice is called lectio divinia, which literally means divine reading. And what this means is to read and reread a passage slowly and intentionally, with that intention, again, of not being in your own struggle, but being in connection with something larger than yourself, with being in connection with God, if you're a believer in God, in being connection with yourself, with whatever is sacred to you. So the idea is to take a passage, and I'll start with a scripture passage, but I don't want to limit it to scripture. One that's very easy for people to remember and to be able to focus on is from Psalm 46, verse 10, "Be still and know that I am God." And so what a person could do with that is to repeat that either out loud or silently. Be still and know that I am God. And then just kind of let that to start flowing. The next step would be to meditate on a word or a piece of that passage that would be meaningful. So it could be that, be still and know that I am God. Be still. Be still. Be still. Find what it is in that passage that speaks to you. And then, if you're a person that prayer is comfortable for you, maybe putting that out. What does this mean for me? Why is this speaking to me? Spend a little bit of time focusing and meditating and praying on how this might change you or what it might mean for you. And then there's a period of contemplation, of resting in silence and connecting, not trying to do anything with it, but holding it rather. So perhaps that be still and rest with it. Not trying to come to any conclusions, letting any other thoughts pass, holding gently what has spoken to you, letting that start to work through you, to find meaning, to find connection. And so that process of reading, of meditating, of praying and contemplating can be done with a variety of different sources. It can be done with poetry. One of my favorite poets is Mary Oliver. She has an amazing connection with nature. And in a poem from The Summer Day, she wrote, Tell me, what is it you plan to do with your one wild and precious life? Tell me, what is it you plan to do with your one wild and precious life? That could be a beautiful passage to do some lectio divina with, to see what comes out of that and speaks to you as you're seeking health and meaning in your life. But we don't have to limit it to poetry. It could be music. Some of you may know this I see song that probably is a little bit, it doesn't quite get to the depth of it, from the Beatles. And in the end, the love you take is equal to the love you make. There could be some really rich contemplation that comes out of that about how we love, how we give love, and how we receive love, and how that makes our lives meaningful. So through the holy scriptures of the world's religions, through that amazing, amazing vast amount of poetry and literature that's been written, through music, I would encourage you to find something that begins to speak to you. Don't make it too long, because that's going to make it too difficult, but something that has depth to it, and that is not going to make it a difficult process, but more a meaningful process. And just give it a try. You know, it's amazing when we try something new, we can find something that can kind of help us cope and calm. And again, be maybe one of those, I need to step away and do this for a few minutes so I can get on with everything else I need to do. I need to kind of reboot my day. Things aren't going well. And something like this can give you the opportunity to do that. So, you know, a short centering prayer, or some lectio divina, some divine and contemplative reading on something that's meaningful for you would be what I would have to offer you today.
Thank you. Those are powerful tools, if we will pause and take the time to practice them. So thank you. We're going to end tonight with a guided meditation. And I'm going to end this after that. So I'm not going to come back on and do any closing remarks. So before we get to that, I want to go ahead and share my screen one more time so that you can capture these, the contact information for our wonderful speakers. So on the screen right now, you can see Johnnessia's email address, which is jonessia@convergencecounselingkc.com. Reverend Kathy Riegelman is kriegelman@kumc.edu. And if you're interested in learning more about the Transplant Mentors program, you can reach out to me, Julie Klima, at giftdonor.org. And I also want to leave you with these tools to come back to. So I'm going to share this recording with everyone that registered, probably tomorrow or early next week. And feel free to share it with your friends, with your loved ones, with your caregivers and your patients, and anyone else that you think could benefit from this. So with that, Johnessia, I'll turn it over to you, and then we'll close this webinar after the end of the meditation. Thank you all for joining us.
All right, so meditation is one of the favorite things that I like to do myself in order to relax. And I typically do meditation at the end of the day, but you can choose when you'd like to do your own meditation. So when doing meditation, you want to be sitting upright. I advise against laying down, because it's not, the purpose of it is not to fall asleep, but to become more centered and relaxed and mindful and have a calm mind. And so I'm going to request that you be seated. If that's on the floor or in a chair, that's fine. If you're in a comfortable space, I do request that you close your eyes. If you are not, that is okay too. You can meditate with your eyes open. And again, we're going to start with some natural breathing in through your nose and out through your mouth. And during this meditation, you may find some periods of silence, and that's okay. Just keep naturally breathing in and out. And I'd like for you to focus your mind on breathing in through your nose and out through your mouth. And on your next exhale, I'd like for you to feel your body kind of sink into your chair or sink into the floor. And be comfortable and be still in knowing that that chair is supporting you or the floor is supporting you. And continue to breathe in and out naturally. We're going to do a body check. Check in with your toes, your feet. If you're sitting in a chair, are they grounded to the floor? Relax in knowing that the floor is going to support your feet and your legs. And if you're feeling any tension there, on your next exhale, I want you to relax that part of your body. If that's your feet, your legs, relax where the tension is there. Check in with your fingers, your hands, your arms. Do you notice any tension in those areas? On your next exhale, I'd like for you to relax your fingers, your hands, your arms. Relax them so there's no tension there. Now let's check in with our shoulders, our neck, our head. Do you feel any tension there? If so, on your next exhale, I'd like for you to relax those muscles. Let your shoulders relax, let your neck relax. As you keep breathing in and out naturally. Now you may notice as you are trying to relax, there may be a thought that comes to your mind. I'd like for you to acknowledge that thought. And on your next exhale, breathe that thought away. There may be another thought that comes to mind. On your next exhale, breathe that thought away. You have nowhere else to be. You have nowhere else to go. But in this moment, focusing on your natural breathing of in through your nose and out through your mouth. Now I'd like for you to take a deep breath in, and I'd like for you to hold it and slowly let it out. Take another deep breath in and hold it. Slowly let it out. One more deep breath in, and on your exhale, let it out quickly. And when you're comfortable, when you're ready, can open your eyes. And that's the end of the meditation.
Thank you very much, Johnessia, for joining us tonight. And also thank you so much, Kathy. You're really appreciate all these powerful tools and your insights. Be well, everyone.